He wants to legalize cross-border insurance purchase. You know, this one, I can't imagine why this one doesn't make sense. If you want to buy health insurance in West Virginia because it's cheaper, right now it's illegal for you to do so. You can buy other things in West Virginia, but you can't buy health insurance there, or Ohio, or New Jersey, or wherever. Now it wouldn't be New Jersey, which has got some of the highest insurance rates in the country, but why shouldn't you be able to shop for the lowest cost insurance policy? Because, you know, if Pennsylvania wants to be dumb and drive up the cost of insurance with a bunch of mandates and other things that make it more expensive, why shouldn't you be able to vote with your feet and buy insurance where the cheapest policy you can find is? Seems to me a perfect amount of freedom. He wants to legalize non-traditional groups. You know, today, 3 groups can sell you group insurance: your employer, trade associations, and unions. You can't get together with your church and become a group for insurance purposes. John McCain wants to make that legal. He wants to create association health plans. I have sort of mixed feelings about this, but this would allow small businesses to pool together. So like all the bars in Pittsburgh could get together and buy insurance as a group on that. Much easier for small businesses. I actually think it's a good thing if done on the state level. I'm a little concerned on the federal level because once you federalize insurance regulation, you sort of create one-stop shopping for lobbyists. But beyond that, I think it's a good idea. He wants to restructure how health care is paid for. He wants to move away from the idea of piecework health care, where we pay you on the number of visits you go to, and try to move to some way in which you get paid on outcomes. He hasn't specified how to do that. I've never actually heard of a plan that works as to how you do that, but in the long run it actually makes sense if somebody could figure it out. And then on prescription drugs, he wants to do exactly the same thing as Barack Obama. In fact, even his rhetoric about how the drug companies profit off of the backs of misery of people is almost exactly the same as Obama's. There was a famous debate where Mitt Romney asked him, said, "Don't treat drug companies like they're the enemy," and he shot back and said, "They are." For some reason, he just has it in for the drug companies, and so he wants to create the same price controls under Medicare and the same reimportation restrictions as Barack Obama. He has opposed S-chip expansion in terms of subsidies. He also wants to means test Medicare. Starting with the Medicare prescription drug benefit, he wants to say if you earn more than $150,000 a year, you no longer will get subsidized drugs through the Medicare program. And he wants to introduce that gradually to the entire Medicare program. It means testing it for wealthy seniors. The total cost of his program is about $3 billion a year. So it's considerably cheaper. Although that probably, he assumes the same savings from healthcare, IT, preventive care, reduced administrative costs as Barack Obama, so I don't trust it in this case either. Let me close with this, if I can. Healthcare and all these debates can get really complex, and I've thrown a lot of numbers at you and a lot of technical terms. We've talked about community rating and guaranteed issue and payout ratios, and yeah, you know, it does get confusing. So let me ask this question, if I can. I think all politics, and particularly the healthcare debate, but all politics boils down to just one single question: who decides? I mean, if you take all the isms of politics, liberalism, conservatism, socialism, libertarianism, republicanism, I don't know, whatever your ism is, it boils down to that very simple question. You know, do you get to decide what school your kids are going to go to? Or does someone else decide that for you? Do you get to decide what charities you're going to support? Or does someone else make that choice? Do you get to decide how you're going to save for your retirement? Or is that decided by someone else? And when it comes down to health care reform, the question we should ask is, do you, with your doctor, get to decide what your health care is going to be, what treatment you're going to receive, how you're going to pay for it, those sorts of things? Or does someone else, your boss, an insurance company, the government, does someone else make that decision for you? And if you look at people's plans and you answer that question, and then you figure out which plan you're going to support. I thank you all very much. I appreciate your listening to me, and I'll be happy to take any questions if you got them.